Welcome to Get the Facts, the program that provides you with information on government's policies and initiatives. I'm your host, Enthros Campbell. Despite the spread, impact, and wide media coverage of the COVID-19 pandemic, we can't neglect other illnesses that continue to affect persons globally. So today we highlight prostate cancer. It's also Prostate Cancer Awareness Month. And our resource person is urologist Dr. Jeremey Thomas. Dr. Thomas, we're so glad to have you. Welcome to the program.
Okay, thank you very much. Thank you for having me, and thank you for the opportunity to speak on such an important problem that affects our nation.
Yes. Let's start first with the definition. What is prostate cancer?
Okay, so the prostate gland is an endocrine gland, a male organ, a part of the male reproductive system. It's right below the bladder and right around the tube through which you pass urine. Its primary purposes that involve in sexual health or reproductive health. It contributes about 30% to the semen volume. Has important enzymes, namely prostate-specific antigen that help liquefy the semen as well as provide the right pH along with the rest of the semen to aid in sperm health. And it also forms an important part of continence in the male. For prostate cancer, as the word cancer suggests, is that abnormal, unregulated growth of cells from a particular organ. And of course, we're talking about the prostate here in this case.
Right.
Several postulated risk factors, whether genetic, environmental, or otherwise. But this is, of course, in general for cancers, not necessarily for prostate cancer.
Okay, so is there a cause for worry among Jamaican men based on the statistics and current trends as it relates to prostate cancer? Yes.
Sure, so absolutely. So worldwide, prostate cancer is probably about the fourth commonest cancer. It's behind lung cancer, colon cancer, and even, of course, breast cancer for women. However, in Jamaica and in across the Caribbean, prostate cancer is actually the commonest cancer, and this is both across males and females. And unfortunately, in Jamaica, it is the commonest cause of cancer-related deaths in our males, and overall cancer-related deaths across both sexes, of course. So it is a cause for concern and really should be spoken about more.
Right. So what are some of the warning signs of prostate cancer?
Okay. So this is the problem with prostate cancer, and this is why this month in particular is actually important in terms of raising awareness about prostate cancer. The early signs and symptoms of prostate cancer are actually none. So the person who has prostate cancer in its early stages, there are actually no symptoms. What sometimes is mistaken as signs and symptoms of prostate cancer is actually not cancer in its early stages. It's actually related to either a condition that's very common in males, especially as they get older, which is known as benign prostatic hyperplasia, which speaks to an enlargement of the gland. It's not necessarily cancerous. Or unfortunately, if the symptoms are related to prostate cancer, then it's actually prostate cancer at a very advanced stage, which is not where we want to detect it. We want to detect it in its early stage.
Right.
Of course, then it is asymptomatic. So that's, if there's nothing else that's taken home from this interview, is that early prostate cancer has no signs or symptoms.
Whoa. So that means we men need to be checking. Don't wait for signs and symptoms, but you need to be checking as like over 40 or so. What age would you recommend that?
Right. Correct. And that's exactly the age. So I see the messages getting out there.
Yes.
So the Jamaica Urological Association, in conjunction with the Jamaica Cancer Society, we have actually set our screening protocol in that men age 40 and over should be screened. That's when you should be, that's when screening should start.
Yes.
You can start with your private practitioner, or if you happen to know a urologist, you can get a referral there. But I'd say your general practitioner should be a good starting spot. And this involves a simple blood test, which measures something called your prostatic specific antigen, or as we would call it, PSA, and a digital rectal examination, which is a simple, quick test, which is a placement of a finger in the back passage to actually feel the prostate.
Yes. Well, all men don't like doing that. What can you do to
Not
help
at
them
all.
through that? They don't like that at all.
Right. So, it's a big taboo and concern, but it is not actually as detrimental or as bad as it seems, apart from, getting probably a bit of lipping on the corner from your friends. But, health is wealth. And, as I said, a stitch in time saves nine.
Yes.
For a cancer, that's the most common cancer in our population and the most common cause of death. It's really imperative that you do not delay in terms of getting the test. The test itself, in terms of the rectal examination or the digital rectal examination, is for the most part, it's not painful. It lasts just a few seconds. And it's a pretty simple, quick test. It's nothing that probably would have been, falsely described to you. It's certainly not going to change your orientation if that's a concern or anything like that. And as I say, it's a necessary tenet in our screening for prostate cancer.
Definitely. Now, there are some foods that our men like to eat, that we Jamaicans like to eat, that we have heard that can contribute to prostate cancer. Is that true?
All right. So
Like
again, that's another,
patty.
I'd say, a misconception. So we encourage a healthy diet. We encourage a diet that's rich in vegetables, rich in fruits, low in processed meats, low in carbs, and so on. But there are no foods that are actually associated with increased risk of prostate cancer. A relatively common question is whether or not food like ackee actually precipitates or potentiates the onset of prostate cancer. This is actually not true. What I will say about prostate cancer is that when it's found in men who are obese, or when it's associated with obesity, we tend to find more aggressive disease, and we tend to find the outcomes a bit poorer. So what we encourage in general is a healthy diet, everything in moderation. We believe in foods that contain antioxidants and anti-inflammatory factors. Of course, your fruits and vegetables will play a role in that. And not only just in prostate health, but in your general health and well-being. And that with exercise, are things that we encourage. There have been several studies that have looked at vitamins such as vitamin E and selenium and a few others, I think even vitamin D. And there have been no conclusive, or there's no overwhelming evidence to suggest that the absorption of excessive amounts of some of these vitamins or other health products actually decreases your chances of getting prostate cancer or the risk of, the type of prostate cancer that you will get. But certainly we encourage healthy diet.
So there are types. But I want to ask, let's go back a little to the PSA. What level is considered high and that should be addressed right away?
Okay, so the value that we look at as normal is a value between 0 and 4. All right, I won't go into the units, but that's universally accepted. So PSA that's greater than 4 is one that is cause for concern. Now, what I will add is that PSA, which as I said before stands for prostatic specific antigen, is specific to the prostate, meaning it's produced by the prostate, but it is not cancer specific. So there are other factors that can affect the level of your PSA. The size of the gland, usually compared to an orange tree. Not that this is necessarily true, but a larger tree will produce more oranges, right?
Yes.
That's quite normal for the size of the orange. Not saying that that's entirely true for the prostate, but you kind of get the idea of what it is that I go along. So a larger prostate, you may see a higher PSA level, a smaller prostate, and so on and so forth. So there are other conditions also that can cause the elevation or alteration in the levels of your prostate, your PSA, such as infection or recent instrumentation. But in general, for screening, if your PSA is above 4, then it is something that should be investigated or explained.
We're going to take a break now and we'll pick up with more discussion on prostate cancer. It is Prostate Cancer Awareness Month. Stay with us.